Hi, I'm Christian Brindle, and welcome to the Everything Medicare Podcast.
What's up, Everything Medicare Podcast Nation? This is Christian Brindle, wherever you are and however you might be listening to me today. Thank you so much for taking the time. This is episode 221 of the Everything Medicare Podcast. Every single week, me and my company bring you a podcast episode on Mondays where we discuss your Medicare, your Medicaid, your Social Security, and everything that has to do with that golden age called retirement. If you're not familiar with who I am, I'm a Medicare health plan expert and specialist. I started working with people on Medicare when I was 20 years old. Worked with my dad, who had been helping people on Medicare since the late 80s and early 90s, actually, before I was even born. And I just love what I do. I love what I do. We work with people in 12 states on their Medicare health plans. We partner with an array of different insurance companies to kind of help people sort through their options and find the best available fit based on their needs and preferences. And we are in October. It is the season for open enrollment for people on Medicare. You have probably already started to see advertisements, mailers. You might even have had people calling your home, showing up at your door. You might have even seen people trying to host events in your area to have you come out to an event, which is actually pretty stupid if you ask me, because we're still have a pandemic going on. We're not doing events like that, but not everybody is as smart as me. I'm of course kidding. It makes me sound like I have a gigantic head as big as this room, folks. I'm here today to talk with you about a change that's taking place to Medicare Advantage plans in 2021. And it's a big change. In my opinion, I think it is the highlight of the season. It's the highlight of 2021 Medicare Changes, and that is this. We're just going to jump right into it. I'm going to talk to you about the effects, the after effects, kind of how it impacts you, what it has to do with you, because I do think it'll impact every single person on Medicare Advantage in one way or another. But that changes this. Ever since Medicare Advantage plans came into the fray, 2005, 2006 time period for the most part, there has been one and only one health question they've been able to ask people to qualify them if they qualify for their plan. So the qualifications has always been, you have to have Medicare Parts A and B, right, active. You have to live in that particular Medicare Advantage plan service area. What I mean by that is a service area is a certain amount of counties. It could be an entire state, depending on your market. But you have to live in the plan's certain area. Each state has plans specifically built for their own state, for Medicare Advantage plans. And so you needed to live in the plan service area. You had to have Medicare Parts A and B. And you also had to be able to pass a health question that says you do not have what's known as end-stage renal disease, which is basically like the final stage of kidney failure, which typically is at the point where you're put on kidney dialysis. That was the one health question. And the main reason why this was the one health question is it's probably one of, if not the most expensive forms of treatment for an insurance company to cover. And so the insurance companies kind of just determined that we're not going to take these people. We're not going to take them on any Medicare Advantage plan. And this was far and wide for different insurance companies. One thing that I think is rather interesting is that health question has gone away for 2021. Now, Medicare Advantage plans are what we would call in the industry as guaranteed issue, meaning no health questions, no underwriting. Now, the criteria is going to be if you have Parts A and B, and if you live in the plan service area. Now, it sounds like a good thing, right? Because people that have end-stage renal disease, it might be a family member of yours, a family friend, somebody that you've known a long time. If they suffer from end-stage renal disease, which is horrible, and I wouldn't wish it on anybody, But if they are in a position like that they can now get a Medicare Advantage plan, right? Sounds good. How can that be a bad thing? Well, with everything, there's some sweet and some sour. And the sweet is that they can get coverage. The sour is for everybody that's on the plan with them. I'll tell you exactly what I mean by that, but real quickly, I got to take a quick break here from this week's sponsor. I'll tell you exactly what I mean and how this impacts everybody on Medicare Advantage in some way, shape, or form. It might impact some of you more than others, but it's something that we need to have a conversation about. Don't go anywhere. I'll be right back. We'll have a conversation about it. We'll talk. Be right back. Welcome back, everybody! Thanks so much for sticking with me through that break. Let's talk about this end-stage renal disease health question being removed and kind of what it impacts. So, essentially, what we have seen is in 2020, Medicare Advantage plans have had what's known as maximum out-of-pockets. What this means, people always get this confused with the deductible. We actually might, as a matter of fact, I might do an entire episode about what the difference is between a max out-of-pocket and a deductible on a Medicare Advantage plan. I think we're going to do that. We have to do that because this is something that people constantly get mixed up. But in a nutshell, Medicare Advantage plans have what's known as max out-of-pockets. It basically means that's it's the maximum amount that your plan can charge you in the form of medical copays in the form of a calendar year. So, for example, if you pay a $10 copay for something on your Medicare Advantage plan on the medical side of things, and let's say you have a $5,000 max out of pocket, that means you now have $4,990 left for the course of the year. It's not a deductible to where they won't cover anything, but until you've met that amount, it's just a max out of pocket. It's a safety blanket. If you ever hit your max out of pocket, the insurance company will pay 100% of your medical bills for the remainder of the year. So the lower the max out of pocket, the better, right? Well, in 2020, the highest a maximum out of pocket could be was $6,700 for a plan that had for in-network coverage. For plans that are like PPOs that go in and out of network, it could be higher out of network, but I digress. $6,700. For 2021, the highest a maximum out-of-pocket limit can be has jumped up to $7,550. And I've seen a lot of insurance companies change their max out-of-pocket to that. They've gone from maybe $5,000 or $5,500 or $6,000 up to $7,550 like that. Several plans in my home market in Utah, but that's just one market. And for out-of-network coverage, it's now exceeds well over $10,000. If you're on a plan that lets you go out-of-network, that is. Anytime you have a plan that basically says, all right, we're going to accept everybody with no health questions, no underwriting, it causes everybody's prices to spike, or it causes everybody's benefits or max out-of-pockets to possibly go up. Now, not every plan is raising their max out-of-pockets like that, like crazy, but several are, and you probably can expect to see that in a lot of places with a lot of plans in a lot of areas. It's no different than the Obamacare effect. I've talked about this on this platform till one blue in the face. The reason why Obamacare premiums are so ridiculously high, unless you qualify for some kind of premium subsidy from your state if you're in a lower income bracket, is because they don't ask health questions anymore. Now, should an insurance company ask health questions? Because then people that really need it can't get the coverage. I'm not sure. I don't know what the answer is. It's a complicated question with a complicated solution. But when they brought out Obamacare, their answer to it was forbid the insurance companies from asking health questions. Now the premiums are borderline unaffordable unless you qualify for a premium subsidy from your state. Even sometimes with the subsidy, they're unaffordable. Right? So this is the same aspect of that. It's the Obamacare effect is what I'd say. The Obamacare effect, simply put, is no health questions, premiums, and benefits rise. Now, I don't think we'll see premiums on Medicare Advantage plans rise, but what we will see is these max out-of-pockets go up. But Christian, why does it matter so much? Why is it such a big deal? The max out-of-pockets, even my plan has a $3,000 or $4,000 max out-of-pocket, and I don't hit it anyway. Because it's just based on copays, right? It's not a deductible. No big deal, right? No big deal. No biggie. On most Medicare Advantage plans, if you do find yourself in a situation where you're on end-stage renal disease and on dialysis, or if maybe you, let's say, need chemotherapy if you get diagnosed with cancer, on those two particular benefits, every Advantage plan that I've ever gazed upon that I can recall pays 80% of those bills and leaves 20% behind. 80-20 split. So 20% of either one of those charges is enormously expensive. Enormous. And so because of that, we are in a situation that if you were on either one of those things, your max out-of-pocket could be $15,000. You'd probably hit it in the year because you'd be paying 20% of the bill up to your max out-of-pocket. That's where this gets dangerous. If you have a $75.50 max out-of-pocket and you find yourself on dialysis or on chemotherapy, you're going to hit that max out-of-pocket. That's what I don't like to see. It's not on normal circumstances. You're probably not going to hit your max out-of-pocket in the event of hospital stays or doctor visits or anything like that. Probably not going to happen, even if you have a lower max out-of-pocket. But if you have something substantial happen, like one of those two instances, like I mentioned, it could happen like that. That's what I'm concerned about. And something you need to be aware of. Keep an eye on your Medicare Advantage plans, folks. Are they adding a fancy new dental benefit, but they're raising your max out-of-pocket to hell? Watch these things. Keep an eye on it. Do not ignore it. If you talk to your insurance agent this year and they're like, oh, your plan's great, ask them, where's my max out-of-pocket going to be? Where's my max out-of-pocket going to be? Anyway, folks, I hope you enjoyed this episode. It was an episode I was dying to be able to make for you. We're in open enrollment. And if you live in one of the 12 states that my company is licensed to do business in and work with people, we'd love to help you this upcoming open enrollment period. We work with people in the states of Utah, Idaho, Colorado, Washington, Oregon, California, Texas, Virginia, West Virginia, Alabama, South Carolina, Florida. Our office number is 801-255-5340, 801-255-5340. Let us help you today. I encourage you, give us a call. No cost, no obligation to you. And if nothing else, you could potentially be on the best thing for you, and we can just tell you that, and at least you know, and you can sleep better at night. Thanks for taking the time, folks, to watch this episode. We really, really appreciate it. And until next time, have a great week. We'll be back with you with another fun-filled episode next Monday. Take care.